before you go on vacation, you gotta know a few things.
Okay, I'm Dr. Brad Weening.
You're Dr. Brad Weening. I'm Dr. Paul Zalzal. Welcome to Talking with Docs.
Okay, on today's episode, we're gonna talk about issues that can come up if you get injured while on vacation.
And this video was inspired by some emergency surgery I was involved with on the weekend.
Okay.
There was a patient from around my neighborhood, well, our catchment area,
Sure.
who was traveling somewhere abroad, had an injury, and then came back here after having treatment, surgery, in another country.
Okay, we're not talking like medical tourism. He went there to have fun, didn't have fun, got an operation, and then came home, and then really didn't have fun.
Yeah, because he came back with an infection from his surgery. He came back with implants that were not Health Canada or FDA approved.
And not put in the proper way.
And they were put in incorrectly.
Yep. Other than that, it was pretty good.
It's a terrible triad.
Yes.
Okay, and we just thought we should warn our viewers about some of the things that can go awry. Do you use that word a lot? Awry? Yeah. I never do.
Yeah.
Some of the things that can go awry when you go travel and have an injury and have treatment at that location.
Okay, so why does it matter when you're going somewhere else? Why does it matter? Why you're just gonna go get surgery? Some surgeon there in a hospital there is gonna do surgery. It's gonna be fine.
Three main things can happen. One, you can have an implant put into your body that is not Health Canada approved or FDA approved or approved by the European regulatory bodies or approved by the sort of regulatory bodies that are governing where you live, what implants can be used.
So it looks like a normal implant, but maybe hasn't gone through the rigorous testing that's required to get things approved.
That's right. For most regulatory agencies want implants that are sufficiently tested before they get approval, and they're manufactured somewhere that follows GMP, good manufacturing processes, an internationally accepted standard of manufacturing to make sure that whatever you're getting was manufactured properly.
Okay.
One.
Second thing, the surgeon.
The surgeon. Is the surgeon board certified? Is he licensed under the same rigorous licensing requirements that the surgeons in your area where you grow up, where you live, do those surgeons undergo the same rigorous training, testing, and all that?
All right.
You don't know.
Number three?
The facility where you're having the surgery or the treatment administered, does it follow the same regulations, similar regulations that the hospitals around you follow?
And it's not necessarily because they don't care, because I've done some volunteer work in third world countries and they want to have a clean hospital. Sometimes things are not possible. Access to materials or sterility is just simply not the same.
You've done it, yeah. You've gone and operated in some of these other countries.
Like in Haiti, for example.
Yeah, it's not, and we're not blaming any of those countries. We're just saying that they may not have the same implants, surgeons, and facilities that you're accustomed to, or you're used to, or that you're expecting.
We're gonna give you 4 things that you can do to try to help reduce your risk of an injury and to get through the process as successfully as possible. Okay, number 1.
Alcohol. Many of these injuries that happen when you're traveling and having a good time happen in the presence of alcohol.
Yeah, or other substances for sure.
Alcohol and other substances.
Yeah.
Okay, so
either don't do that or drastically reduce the amount of those substances that you consume.
Don't drink excessively. When you're at the bar, maybe consider saying, good barkeep, before you give me that next margarita, are your surgeons board certified in this area?
Yeah, I suspect that person may or may not know the answer to that question.
Probably not.
Okay, number 2. Avoid high-risk activities. I feel like when we go on vacation, people do crazy stuff.
Yeah, all of a sudden it seems okay to do a high-risk activity that you wouldn't consider doing at home.
Like, what are you thinking about?
Zip lining, for example.
Yep.
Maybe before you get in that zip line, as you strap on the zip line, the person there that's helping you get your harness on, say, good sir, do you know if your facility follows sterility procedures similar to the ones where I come from before I strap on the zip line?
Or same with like parasailing, which doesn't make a lot of sense to me. Someone else is packing your sail and you got those tiny little carabiners and there's someone driving the boat that I maybe don't have total confidence in, and just stuff happens out there when you're floating up above the water. And water is really hard when you fall at a rapid rate of speed.
Yeah, when good times go bad, you want to make sure you're somewhere where they have appropriate medical facilities.
Maybe just don't do that. It's like skydiving for me. Number 3.
Flip-flops.
Yeah, it's in the name.
Don't wear flip-flops. That's why they're called flip-flops. You flip, then you flop. You don't want to wear flip-flops because they're not a very stable piece of footwear.
Sure.
And now you're walking around in another country where even the regulations, believe it or not, there's a code for everything. So how high a step can be, or how big a crack can be in the floor before you step in a crack. All these things are sort of regulated by different codes. And you may be visiting a country that doesn't follow the same code. So your whole life you're walking around expecting a step to be X number of inches high. All of a sudden it's X plus 1, and bang, you flip. And you don't want to have flip-flops on when you're trying to navigate uneven ground like that.
You could argue even on the beach. I mean, soft sand, that's where people roll their ankles because it is uneven and it's not normal. You're not normally used to walking on sand.
I mean, the flip-flop is designed not to follow your foot perfectly.
Right.
That's why it makes the flip-flop sound.
There you go. The last one is travel insurance. We think that this is a critical thing to consider. It can be expensive, but often money well spent. This is not going to help you prevent the injury, but it is going to provide you access to some level of care there.
Absolutely. The one thing to keep in mind with travel insurance, so travel insurance may guarantee that you will get reimbursed for your treatment that you receive, but it does not guarantee that you're going to get world-class treatment for your injury.
And there are some limitations. You can't say, well, I just want to go home and get surgery. Depending on the type of injury, you may require care immediately or in the center that you're in. I would say the other caveat too is definitely look at the fine print of your travel insurance, because some travel insurances are invalidated if you have been consuming alcohol or drugs. So be careful.
So there you are. If you've had a few too many drinks and you're wearing flip-flops and you're about to enter the merengue contest with the eyes on the prize, you may be at risk.
So maybe don't do that.
Yeah, maybe second place is okay.
Just dial it down a bit.
All right. Enjoy your vacation. Be safe. Watch out, because your implant may be not certified. Your certified surgeon may not be certified in a facility that's not as clean as you expect. So don't drink too much. Don't take high-risk activities. Don't wear flip-flops, and get some travel insurance. Understanding it doesn't guarantee that you're going to get world-class treatment.
If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health and your own fun you're going to have on vacation.
We'll see you next time.